Hello, today it is the 10th of June and I have been to my CBT appointment, and today it was looking at actually starting the exposure therapy. During the last week I've been asked to complete a document, and it was looking at the different things that caused me distress and anxiety, and actually rating the levels of anxiety from 0 to 10. And I had to rank them then with the thing that caused me most anxiety up at the top and the other things down towards the bottom. And towards the bottom, or actually right at the bottom, I had looking at needles. So I am actually okay now with looking at pictures of injections and needles and syringes, but whenever I've seen one, so if I've gone into to see the practice nurse and there's been a syringe on the side because she wants to take some blood tests, straight away that increases my levels of anxiety. But I have control over that situation and I say no blood tests required. However, this exposure therapy, it's about not using any of the coping strategies that I've tried in the past. It's about facing your most catastrophic event, and that's catastrophic event. That they mean by that the worst case scenario, which for me would be dentist, needles, blood tests, and starting to look at managing those situations without relying on something to support you through the process, and about getting your brain to understand that the actual event when it happens, i.e. a visit to the dentist or taking that blood test, in my mind, what she's trying to get me to think about is it will never ever be as bad as my brain telling me that it actually is. And I get it. I totally and absolutely get it. So today I was up for starting some exposure therapy, and what Leslie did was actually get a couple of syringes out in the room and asked me to talk about how anxious that made me feel. And I did have a little bit of anxiety. I could feel my heart rate raising a little bit, but nothing much more than that, because I knew that I had some control, i.e. I knew she wasn't going to stick a needle in me, so it didn't make me too stressed. And ultimately I was able to hold a syringe in my hand, unsheath the needle and actually lay it on my skin. So not the pointed end, just to lay it on my skin. So over the next week, well, actually it's going to be 2 weeks now before I see her again, she's asked me to regularly touch my skin with this little item. So this is a syringe, and I hope you can see that there's a needle there attached to it, currently sheathed with a piece of plastic, of course, to make sure it's as safe as it can be. And the idea is that as I do this day by day by day, the levels of anxiety that I actually feel just by looking at it and by touching my skin should actually decrease. So currently when I see a needle or injection, my levels of anxiety go whoop, and then when the whole process is over, it goes all the way back down. What she's trying to get me to do over the next week is stop that level of anxiety going straight up there. So we're hoping that we're just going to kind of do that. And each day as it goes on, the levels of anxiety that I feel will hopefully lower. So that's the start of this exposure treatment. Obviously, at some point, we're going to be dealing with the catastrophic event, which is dealing with actually having an injection or at least a needle stuck in my skin anyway. So, right, that's it for now. Excuse how I look. I have just got out of the bath. So this is me. Without any makeup or anything on. Anyway, thank you for listening. And as I say, it will be 2 weeks now before I see the therapist again, and then we're going to start and look at what else I can be exposed to. So once again, thank you for listening, and I hope you found that interesting.